Nanji Hamer, and I will be presenting on public health and mental health counseling. Public health is defined by the CDC Foundation as the science of protecting and improving the health of people and their communities. This is implemented through educational efforts, creating policies, and the cooperation of members in the community. This involves epidemiology and promoting preventative methods such as increasing personal hygiene. Health promotion is defined by the World Health Organization as a process of enabling people to increase control over and to improve their health. The purpose is to increase health equity so that everyone will be able to have an equal opportunity to achieve optimal health. Health education, defined by the World Health Organization, is any combination of learning experiences designed to help individuals and communities improve their health by increasing their knowledge or influencing their attitudes. The purpose is to improve individual self-efficacy to engage in a beneficial health behavior. Health prevention is to prevent or decrease the susceptibility of diseases or illnesses by engaging in beneficial health behaviors. For my career project, I use an example of mental health counseling. A mental health counselor is a health professional that assists clients in achieving mental and emotional wellness. They also do assessments, develop treatment plans, provide psychoeducation, and crisis management and prevention for those usually suffering from a chronic mental illness or disorder. Health education competencies is defined by the National Commission for Health Education Credentialing. The core responsibilities, competencies, and sub-competencies provide a comprehensive description of the profession, illustrating the skills necessary to perform the daily tasks of a health education specialist. This is important when ensuring the success of the health educational program. The first competency is assessing needs, assets, and capacity for health education. This entails identifying the materials and resources available for a health education program, identifying the influential factors of the program to seek areas of improvement, and collecting quantitative and qualitative research to identify the issues that affect a certain population. So as an example of a mental health counselor, I would sit down with a new client and assess their mental status and discuss what services that they would like to receive from the program. The second, plan health education. This entails designing a strategy that will fit the program, identifying the target audience for educational topic, develop a goal and objective, and identify potential barriers. If I was in program planning for health program, I would use a logic model because this would be the most beneficial way to organize the program and everything that reaches the needs all the way down to the potential barriers. However, as a mental health counselor, as an example, I may sit down with other counselors on a team to discuss and develop a treatment plan that would best suit the client. The third is to implement the health education, so putting the plan to action. As a mental health counselor, I would discuss the details and nature of the treatment plan with the client themselves, so that we will be able to begin our therapeutic sessions. The fourth, conduct research and evaluations related to health promotion and education. This entails finding and designing an evaluation tool that will be suitable to the program. Well, in this case, as an example of mental health counselor, that would be suitable to the client. Next, I would collect, analyze, and interpret the results from the evaluations to examine the progress and success of the program. As a counselor, I will periodically give my clients a survey or an assessment to examine their thoughts and feelings about the program to find areas of improvement. In addition, to address any personal goals that they may have changed throughout the time. The fifth, administer and manage health education. This entails budgeting, managing human resources, finding stakeholders, partnerships, and donors to accept and support the program, ensure that ethical standards are being upheld. As a mental health counselor, there wouldn't be too much involvement in the financial process if they are providing their services within a large facility that makes those decisions. If one is running their own private practice or based in a small program, then they would be more concerned with establishing partnerships that would support the program and find funding, possibly from a government organization. On a personal one-on-one basis, when interacting with a client, I could get a report on the client's progress through follow-up sessions. In addition, to ensure that ethical codes such as HIPAA is being maintained when dealing with clients' confidentiality. The sixth, serve as a health education resource person. So this entails serving as a representative for health education related information and providing training. For this, I would add to the list of responsibilities to continue to develop and evolve through one's knowledge on health education, because as a health professional, I feel it's important to continue growing your knowledge on the growing information in the field, along with technologies and tools that's being used. As a counselor, I would make myself available to my clients when they need help understanding their diagnosis or adopting healthier coping mechanisms or addressing any concerns with their treatment plan. The seventh, communicate and advocate for health and health education. So this entails engaging in health education advocacy by assisting those in need of help with health education. As a counselor, this will be a large part of my responsibilities as a health professional. Counselors do not only provide many levels of support for their clients, but they also advocate for their clients' behalf to provide them with the best available resources. For the health organization I chose to research is Phoenix Health Programs, based in Columbia, Missouri. Phoenix Programs is a substance abuse health agency and a nonprofit organization. They provide services for both men and women, ranging between adolescent age to older adults. Their mission statement as follows: we provide effective treatment for those seeking recovery and drug and alcohol addiction. The region and location that they serve is primarily in Columbia, Missouri, but they accept anyone residing in Missouri. However, they do not cross state lines. Some of the services that they provide is a detox program, where it's the first step to those seeking assistance with their drug problem. In order to receive any services in the program, they would need to detox their body from any substance. While in detox, they are provided a bed and are monitored closely for their safety. Mental health services are provided for the clients because oftentimes when someone is abusing drugs, they are also suffering from a mental illness. This is called a co-occurring disorder. If their mental illness is being addressed simultaneously when they are receiving help for their drug addiction, the client chances of relapse is high. I'm sorry, I meant to say if their mental illness is not being addressed simultaneously while they are receiving help for their drug addiction, the client's chances of relapse increases. I will go into more detail about the residential program later on. The outpatient program is available for anyone living in Missouri, primarily Columbia, Missouri, and they are provided with educational classes on relapse prevention. Medicine Treatment Assistant Program provides various medication options, such as helping those suffering from withdrawal symptoms, to help decrease cravings, and to treat any mental illnesses that they may have, such as depression or schizophrenia. The HCHV, Healthcare for Homeless Veterans, allows any veteran to be submitted to the program as long as they are suffering from a mental illness and struggling to find permanent housing. They are provided with mental health services, temporarily housing up to 6 months, and assistance with finding beneficial resources. The SATOP program, Substance Abuse Traffic Offender Program, are for those that have been court mandated to go to a rehab facility and attend educational classes on topics of drug addiction and impacts of drug addiction. The residential program allows individuals to stay up in the facility for 21 days within a certain part of the building that provides them privacy. For them to be admitted into the program, they will have to go through the detox program first. After, they will be able to access mental health services along with medicine treatment assistant program, and they're required to attend educational classes on relapse prevention. So why is Phoenix program unique? Clients do not have to have any insurance to be admitted. With many rehab facilities, they are particular on the type of acceptable insurance. This makes it hard for those in need of seeking treatment. The counselors that teach the educational classes and provide mental health services at Phoenix have also been through addiction themselves. They all have achieved their appropriate degrees and licensures while accumulating an extensive amount of years of sobriety. This creates an open and non-judgmental atmosphere and allows the clients to build a strong bond with their health counselor. And below is the link to the organization site. why I enjoy public health and learning about public health, because I feel that any career path within public health will be very gratifying for me, because I will be able to give individuals the tools and knowledge to make a positive change in their lives. Also, I will be able to address disparities that affect communities and populations and be an advocate for those in need. The goals for the future is to achieve my BA in Health Science General Track with a minor in Biology. I would like to become a licensed practical nurse because I have done the duties of a licensed practical nurse, and I feel that I am competent enough to do those responsibilities and maintain them. I would also like to become a certified health education specialist because I would like to have more certifications on my resume as a new graduating student. And those are my references. Thank you.